So why don't we open up the meeting and then we'll just move the agenda around a little bit.
And public comment first?
Yep.
Yeah.
Yep. Okay, so let's get started. This is a Northampton Board of Health meeting on January 15th, 16th, 2025. Is there anyone here for public comment? Please raise your electronic hand, which you can find in the reaction tab. Is there anyone here for public comment? I don't see anyone. Oh, somebody just wants to come in. We're going to let them in. Is there anyone here for public comment for the Board of Health meeting? Please raise your electronic hand, which is under the React button. All right, I don't see anyone here for public comment. This is the Northampton Board of Health meeting on January 16th, 2025. It is 5:36 p.m. This meeting is being recorded. Tonight we have members of the board. We have Cynthia Swopis, Suzanne Smith, and myself, Joanne Levin. We have a quorum tonight. We are missing one of our board members this evening. Meredith, do you want to introduce staff?
Absolutely. Tonight on screen with us, we have Director of Environmental Health, Amy Hutchins. We have our Executive Assistant, Scott Hoiberg. We have Inspector Extraordinaire, Donna Bowman. Love it. Kelly Constantine, our Department Assistant. JJ Prusak, Inspector of Regional HPH SSC, which is our Public Health Excellent Collaborative. I'm assuming that's JJ Prusak there. And then we have Jen Denkowitz, who is our public health nurse.
And is Lisa from our staff or no? No.
Don't think so. Okay. And Donna, can you confirm, is that JJ Prusak with us? Or
yes, it is. JJ is sitting in tonight.
Okay. Yeah. All right, great. Thank you.
Great. So would anyone like to make a motion to formally open our Board of Health meeting?
Move to open the meeting.
Second.
Great. Thank you, Kelly. That is Lisa from our staff. Any discussion? All in favor? Cynthia?
Yes.
Suzanne?
Yes.
Joanne? Yes. Okay, Board of Health meeting is open. We do need to rearrange the agenda because our guests are not scheduled to be here until 6:35. So Jennifer, are you prepared to present?
Sure. Yeah.
Great.
Thanks. Hi, I'm Jennifer Denkowitz. I'm one of the public health nurses for the city of Northampton, part of the team, and I am going to share my screen. Bear with me. Let's see. And it is not here, of course. Hold on, we're gonna. Oh, la, 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 la.
You can't get it, Jen, let me know.
No, I can't, if you don't mind. Sorry about that.
As long as you forgive me for mispronouncing your last name again.
Oh, no,
I'm
not a
so
problem.
Sorry. Let's see.
We have Melissa coming in next week to do a kind of overhaul on our nurses' systems to make sure that we're all on the same page and get access a little bit easier.
Unfortunately, a connection keeps coming in and out. And we made a plan, though, this time we forwarded along the presentation. So worked great earlier. Any luck, Meredith?
Yep.
Well, I could just start talking too.
Give me 1 second.
Okay.
Can you see my screen?
Let's see.
Not yet.
Not yet.
No, huh?
Back up
There we go.
Okay, so now I just have to go to view and full screen.
or slideshow.
And a slideshow.
Okay.
It's right. Yeah. Down. There you go. Hopefully that'll pop right up for us.
Beautiful.
All righty. I might have to ask you to move the slides for me. Oh, and sorry about that, but do you guys hear me?
Yes.
Okay. All right.
There's that bar in the way. What is that?
Oh, is that my,
That's you. Your
Yeah.
Zoom just quit unexpectedly,
okay.
possibly.
Oh, you're there. There's just some.
Okay, here we go. So I thought I would start talking about our respiratory illness update for the Hampshire County Emergency Department visits. This is a snapshot of what's going on in the COVID, influenza, and RSV worlds out there. We do have a COVID influenza is moderate and RSV is high levels right now. And we have to remember that this is just a measure of how many people are seeking medical care in emergency departments. And while the levels might be high, it's just indicating that people are feeling sick enough to go get some help. Next slide. We're going to look at the wastewater viral activity for Northampton, and we are trending up right now as we normally do after the holidays, a little bit lower than our summer uptick, but this does not reflect case count. We have to remember this is just showing trends, and we were expecting this. And next slide. These are just some prevention tips for keeping yourself and our community healthy. And we'll start with the core prevention strategies. Getting immunizations is an excellent way to keep yourself healthy. Healthy hand hygiene and respiratory hygiene, for instance, not sneezing all over your neighbor or anybody in close proximity. Steps for cleaner air. Let's get that, be exposed to as much fresh air that you can be. The good thing about getting tested is then if you are ill, you can seek out some treatment that might help with the healing process. If you are sick, please stay home. There are guidelines out there, and we want you to stay home for when you're 24 hours free of fever and symptoms, and take the additional precautions for the next 5 days to keep people healthy. Additional prevention strategies are masks, social distancing, avoiding crowded areas. USPS is offering free tests per each household. Take advantage of that. You can check it with your pharmacist too, because some of them are able to bill your insurances. Some insurance companies out there are definitely helping out with that. Next slide, please. We're going to go into some upcoming vaccine clinics throughout the DHHS. We have one next week on January 21st, 3 to 5, and thereafter we will be doing them monthly at council chambers. And if we need to put more in, we will. We are going to the Amherst Bank Center on February 2nd from 3 to 5 as well. Other targeted clinics throughout the community are Manna, Meadowbrook, and we're targeting some restaurant workers to get everybody safe out there if they'd like the vaccine. Currently, the DHHS offers Pfizer vaccine for adults and Moderna and Pfizer for children. Checking with our local retail pharmacies and grocery stores also offer a variety of vaccine types out there for folks. All right, next slide. Norovirus. I'm sure that people have been hearing about this, and we thought we might just want to talk about it tonight. It's referred to as a stomach bug, very, very contagious. It only takes a little bit of this virus to make you sick. It's grouped as one of the viruses, the diarrheal illnesses. Some of the signs and symptoms are nausea, vomiting, diarrhea, abdominal cramps, chills, muscle aches, fevers, headaches. The symptoms usually begin about 1 to 2 days after exposure. They can last up to 3 days, and sometimes it can take folks to recover up to 3 weeks. You are asked to definitely to know that you are an infectious even 72 hours post symptom resolution. A lot of folks don't know that. So it's transmitted fecal vomit oral transmission, ingesting contaminated food and water, person to person, touching infected surfaces, and unfortunately can get sick by inhaling aerolized vomit. Let's go to our next slide. Let's see. Okay. Where I'm missing a slide in there. I'm just going to speak a little bit more about oh, yeah. Yes, there we go. Yep, that one. Thank you. Norovirus can be diagnosed through lab testing of stool or vomit. There are a few labs that do the vomit. Patients are usually diagnosed by a symptom, not necessarily labs, because it's really difficult to show the case counts. And folks are sick, they call their doctor, oh, we think we have norovirus. In places like school settings, long-term care, things like that. They are out there testing stool to keep everybody safe and stop the spread of the virus. Treatment is hydration, rest, and most often norovirus will resolve on its own. For prevention measures, it's important to know that hand sanitizer doesn't work necessarily with this one. Washing your hands with soap and water for 20 seconds is what we need to do, especially after we use the bathroom, changing diapers, before and after cooking and eating food. Make sure we wash our vegetables and fruits and cook them thoroughly. If one person would be ill with the GI symptoms, it's really important to clean all those surfaces, and it's effectively cleaned with bleach-based cleaners. A little statistic here from Norostat, which is the CDC posted this. They receive information from participating public healths monthly, and the findings from August to December in 2024 were 494 cases. And last year at the same time, it was 363. So next slide, please. Another topic that's out there people are speaking about is our H5N1 avian flu. And I just wanted to give you a little update. Back on January 7th, the PHN team went to a webinar given by many folks, but good information given by Katie Brown, a Mass State epidemiologist who is also a state public health veterinarian, and she shared some great information with us. We are all being updated with new information as it becomes available about this H5N1. This strain is definitely evolving and circulating throughout the wild birds globally and in the US. It's spread through wild waterfowl due to migration, and domesticated birds have been infected. This past year, 2024, this strain actually spilled over into cattle in multiple states. There is no evidence of H5N1 in Massachusetts at this time. Mass Agriculture has been doing some milk testing since August 2024, and the testing is ongoing, so that's good. Human cases were noted from close contact with infected cattle, exposure to the unpasteurized milk, and birds. Next slide, please. Lots of words up here, but I'll just go through them. In January 2025, the CDC announced the death of a person who was infected from her backyard flock. Just to give you a little history on her, it was noted that she was over 65 years old, had some pre-existing conditions what could have contributed to the disease severity. Historically, flu affects those with a weaker immune system, children, older adults, and those with comorbidities, and that could be one of the reasons why this person passed. So far, there has been no human-to-human transition at this time, and we will be made aware pronto if any of that happens. So for some prevention tips, please don't drink unpasteurized milk. Don't touch wild birds. If your livestock animals look sick, make sure you stay away. And if you are tending to them, you need to use some personal protective equipment. CDC has a great educational tool out there for this and for our backyard flock owners. At this time, the USDA does not recommend removing backyard bird feeders. However, they are really stressing the importance of keeping your backyard bird feed separate from your backyard flocks to decrease the contamination. And Mass Department of Public Health and CDC plan on surveilling and starting case investigation when necessary. Next slide, please. Public health nursing outreach in the community. Just wanted to give you guys a little snapshot of what we've been doing. Our homebound vaccine visits continue. Community outreach is ongoing with our DCC, and we do educational boards updating participants along with staff with pertinent health topics. BP monitoring and education continues at our Northampton Housing Authority properties, our Northampton Senior Center, our Public Health Excellence Grant participants in Plainfield, Huntington, Middlefield, and Hatfield get visits from us. In March of 2025, the public health nurses will be meeting with the school nurses to discuss our childhood vaccine program. And us PHNs, we attend monthly mass public health nursing meetings with a DPH nurse that keeps us updated and current on events and training to strengthen our practice. Next slide, please. All right, and as I'm sure that folks have heard, we are amidst our Healthier Northampton Chinna Community Needs Assessment, and it's a tool to collect data about our community and the needs that we need to ensure a healthier community. Lots of DHHS staff members are out in the community, tabling events, and we just did a lovely code red and got across the city, and we got some great numbers with response. So this is an excellent tool for us to be able to fill the gaps of care that are recognized in the community. And that's what I have to say.
Great, thank you so much.
Sure.
Questions for Jen?
Thank you, Meredith.
Thank you for reporting on avian flu.
Mm-hmm.
You're very
Cynthia?
welcome. Thank you, Jen.
You're welcome.
Cynthia, go ahead.
Thank you so much, Jen. And I wanted to ask you, I remember we had a goal for I think it was 3,000 surveys or 5,000 surveys. How are we doing with that?
Well, I unfortunately don't know the exact number. Is it 1,000? I think we're up to a little bit over 1,000. I think we're there, right there, and hopefully with the tabling and the code red call out to the community, that's going to hopefully boost our numbers.
So I had a very ambitious goal of 5,000 in the beginning, but our committee tempered it down to 3,000, which is still very ambitious based off our population and our adult population. So I think right now, Scott updated me, we're probably close, a little over 1,300
Oh, good.
surveys. The code red that went out this week boosted the surveys up by 200, at least by 200 for that one call, which is great. So our ask is to all of our Board of Health members to please take this and share it with any listserv that you may be on, and your friends who live in Northampton, and ask them to share it as well. This is going to help drive and create the roadmap for DHHS internal programs and initiatives, but I'm also hoping that it'll help drive some of the policy work for the Board of Health as well. So we'll have, if everything, if all the stars and the moons are in line, we'll have 2 strategic plans when all is said and done.
Meredith, should I run into someone where there's no access to any communication system and they ask them, how can they participate in this survey? Is it available through the public health?
It is, yes.
Okay, thank you.
Yep, and we can even mail it to them and we'll provide them an envelope to mail it back in as well. So we've got lots of different ways that you can get the survey. If somebody needs help, we have someone in the department that can assist. We're trying to cover all our bases for sure.
Thank you.
Scott just said that they're almost 1,200 complete and 190 partially complete. Thank you, Scott.
Thank you, Scott.
When you said 2 strategic plans, what does that mean?
One for the DHHS and one for the Board of Health.
The Board of Health or the Health Department in Northampton, or?
Nope, the Board of Health, you all.
So I didn't know we're doing a strategic plan?
I'm hoping that we can based off the results of the China.
Gotcha.
Mm-hmm.
Okay, great. Good.
Yeah, I'm hoping there's policy work. You know, some of the questions lead into policy changes.
Meredith, do you know when this survey went out? Because there was a comment in our minutes that it started in 2022. Is that correct?
No.
2024?
Yeah,
Yes.
it went out probably maybe late October, early November. We wanted to miss this back to school rush, parents being busy. So I don't know the exact date, but yeah, it was the fall, late fall of last year. And we didn't set a term date when to stop. I think, you know, as soon as the responses start coming in, we'll close it down, and start the assessment. I'm hoping by the end of the year, the end of the fiscal year, that we can start working on our strategic plans.
It's a good goal.
Great. Any other questions for Jen? Thank you so much for coming.
Thank you.
Jen,
Thank you, Jen, so
Thank you
much.
very much.
Oh, Jen, I have a question
Oh,
for you. Wait,
yes.
yeah. I don't get a lot of FaceTime with you, so I've been meaning to ask this. Do we have any interaction with the school nurses? Are we meeting with them on a regular basis?
Our next meeting is tentatively March 2025. I've been speaking with Kristen. I spoke with her last week, and they are bringing the suggestion for the meeting to their meeting. And we thought that March would probably be the best because February next month would not work. So March seems like a good time. So I have it tentatively on both of our schedules, and the whole team wants to go and sit with them and talk. So very excited.
Fantastic. That's
We had
great.
a lovely conversation via phone last week and the planning for all this. And I think that's our goal as the public health nurses, obviously to be there when they need us, but at least having a yearly meeting to see where people are at and see, you know, what needs they have so we can help assist with that.
My goal would be to sit on their wellness committee or something.
Yep, that's actually been talked about, and yep, I can bring that up again. Absolutely. Yep.
Fantastic.
Thank you.
Thank you for the information, Jen.
Sure.
Have a great night. You're welcome to stay if you'd like.
I'm going to stay.
Oh,
Yep.
fantastic. Great.
So we can rearrange the agenda again and talk about there's various substances that have shown up in convenience stores and head shops that we think may be dangerous, but that are not really yet illegal or banned. Meredith and I were talking that since nothing seems to be coming from the state, that maybe we should make our own regulation. And although it's a whack-a-mole game where you ban one thing and something else pops up, we could just revisit it every year or two and update it as needed. What do you think of that?
No further guidance from Cheryl?
She hasn't gotten back to me. I did look at MAHB and MHOA to see if they had anything out there, and they didn't. But I did a quick search today to see what communities and or states have regulations, and Scott is gonna take project lead on this and do some research. I just handed him that task about a half an hour before the board meeting, so he doesn't have anything to provide for you today, but he's gonna start collecting information and putting it together for us, and then we can review it.
This,
HO has model regulations, which we, mhm.
this really is major league whack-a-mole. The people who create these, if you call them designer drugs, are always one step ahead of us. If we're going to embark upon something like this, wouldn't it be prudent to have some access to testing so we know what things are if we're banning them? I mean, if they're very straightforward marketing labeled as a product that's recognizable to us, that's one thing. But other things that are given names that may or may not have anything troublesome in them, it is a problem.
So, I mean, that is a really good point. I honestly think, hold on one second, Chuck. Having a partnership with the DA's office and the Northampton Police Department could help with that. I mean, we should not be the enforcers of getting illegal drugs off the shelves of retailers. But I think because broadly, Suzanne, I'm saying this, that our retailers don't even know that these are illegal drugs. It's more about like education, regulation, right? But then have a written enforcement piece and a partnership with the police. I do know in the past that I've used the police when there were illegal products on the shelves and they have confiscated and testing. So there is the, there is the capability. I don't know about capacity, but there is the capability of that happening. But yeah, that would definitely have to be considered.
And do we have capacity for inspectors to look in these shops?
Well, we're there anyways, Joanne, again, but it's going to be a huge learning curve because it is whack-a-mole. They're always changing names. It's knowing how to read the labels, what the drugs are. So it's, I mean, Amy, I'd like Amy's input on that. Well, I mean, they're busy. We look at a lot of things, but we are there and it's prioritizing, public health. Like this makes sense to me. It's really good public health that just, it's not regulated. I hate that it falls on us, but
Yeah, they are looking for it anyways, like Donna documents when the things that we can't enforce, they have a spreadsheet that they document. I think they shared that a little bit a while ago, what that looked like. So they're already documenting it, but it is an education piece too.
The whack-a-mole nature of this, as I understand it, is the reason that there are not laws and regulations around all of these substances, because that's a long process. And by the time legislation or regulations are developed, they're already one step ahead of us. I'm not saying that this is not something we should undertake. I'm just trying to be cautious about how difficult these can be outside of the usual suspects.
And do I remember that when Cheryl Sabar was speaking, that maybe there was a way to do it like broadly, more generically and not specifically, so it wouldn't be so much of whack-a-mole? Does anyone recall that? I felt like
I have
that.
to look back at my notes, yeah.
Yeah.
that's what we were looking for, was this umbrella language to capture it all. And she didn't have that answer for us. In fact, the guidance and I'd say model regulation that they provided to Belchertown, because Belchertown passed the prohibiting synthetic THC and kratom. But that's very narrow scoped, and it's successful though. They've had no violations, or they didn't early to mid fall when we had a meeting with Belchertown. They said all the retailers didn't even know it was an illegal product, took it off their shelves happily. It wasn't even a big seller, they were saying, and haven't had any violations since. And that's kind of the same, same results we got when we did that with bath salts and something else in the past. I remember it was educating the retailers, asking them to take it off their shelves, and they're like, whoa, yeah, of course we will. So yeah, I leave you with that.
So we're talking about some things that are illegal and some things that we don't know are harmful, let me just say. Is that what we're saying? Like is cardamom illegal?
Kratom?
Kratom.
Um,
Or do we have the power to make it illegal as a board?
right, yeah. I mean, I don't have the answer for that.
Because I'm thinking, there must be a data clearinghouse, something that if we bought some of these substances, we can run them through some kind of a check. And if not, we could think about umbrella language ourselves, because it seems to me, I don't know, I just don't know if MAHB is really helping us here.
Right.
And maybe we should just, you know, put our feet forward and come up with something.
Mm-hmm.
This is where AI jumps right in here. The FDA has not approved kratom for any medical use, and the DEA has listed kratom as a drug and chemical of concern.
Of concern.
That might be an interesting list for us to have access to, what the DEA considers a drug of concern.
Yeah.
That would be some type of review at the federal level about all of these substances and what they're actually concerned about.
Yeah, that's a good point.
And I think I sent it to Meredith the other day, a report from the CDC, I think it was from the CDC, about a drug that was supposedly a product that contained some kind of mushrooms, and that people were ending up in the ER with potentially severe consequences for this particular named product. So I mean, things like that we can, it's not going to be perfect, but we can probably develop a list of things that we have reports on as being dangerous, potentially dangerous. So we'll see.
I mean, it's sort of like the red dye 3 thing that just came out. We know it causes cancer in rats, but we're not sure if it causes cancer in humans. And yet it's been banned now, right? So, I mean, I think we can.
Years.
What's that?
It only took 50 years.
Yeah, but it's like experimenting with some of these things, like, let's put less nicotine in the cigarette. Let's see what happens. I mean, I think we could, I don't know. I think we have an opportunity. I mean, it's educational and it's also policy driven, so.
Were we not speaking about nitrous oxide just a short time ago? And what's the status of that?
I think that would be included in this policy if we choose to do it. That has some real commercial uses.
Right.
The language has to be written the right way.
Are they not following?
It is illegal to be used it's illegal to be used for the purpose of getting high. I mean, there is some language around that too. So that's the road that we thought we would go down if everybody's in favor of looking into that.
Yeah.
And Scott, in your when you do this research, if you find actual policies or written language about it. If you can just download them and sort of create a file of all of them so we can look at the language that's used, that would be really helpful.
You got it.
Right? Okay, great. We did not have anything else on our agenda. Oh, we could do minutes, I guess.
We could do minutes, but before we move to minutes, I also want to let you know that Shop Therapy and the Vault, two of our tobacconist stores, are closing their store and both moving into, it's the same owner, into Faces, and they're
Yeah.
no longer going to be selling tobacco. They came into the office Tuesday, maybe, Amy? Yeah, Tuesday, and said that they weren't going to renew their tobacco permit. And Amy and Kelly both, informed them what that means, that if they don't renew, that it's going to be retired and gone forever. And he said he understood, but I asked Amy to follow up with a letter just to make sure that it's very clear that if they don't renew their tobacco permit, that it's gone forever. So that would bring us down to 22 permitted establishments. We started, I think, at 37 or 38 when we did the permit cap and reduced through attrition years ago. So that's almost half.
Very
They
nice
say
work,
why?
Emily.
Do they say why? I don't know. Did they say why, Amy?
They did not say why. Kelly, I think he said, why not? Like he had like a very funny answer, but it was good. It was a good answer. And I did send those out yesterday, the letters to
You
him.
did. Thank you. Yeah, I don't know if his business model's gonna change from a head shop to more like Faces. I'm not sure. I'll be interested, but he didn't
Yeah.
apply for a food permit or anything, did he, Amy? No.
That is interesting.
Yeah.
That brings us down to one tobacconist.
Mhm.
So
Amy-
from three
yeah.
to-
That's great.
Brings us down to one, what, Amy? I'm sorry.
three tobacconists down to one. So that's tobacconist is who can, that you have to be 21 in order just to get into the store.
Right.
And
So
that's,
it's the flashy place on Main Street is the other one?
yes,
Mhm.
yes.
Mhm.
Down by, it's Old Brugger's, I believe.
I went in there to just sort of look around. I I don't know what I was doing in there. I couldn't recognize anything.
So we could do minutes, and then if we wanted to improvise, and I'm gonna put Amy on the spot. Two things, if you want to update about the funding for the ventilation task force, where you've gotten with that. And then if you really wanted to, Amy wrote up a nice 2024 overview of environmental health, of inspectional services, if you just,
Can you do minutes and I'll find both of those.
okay.
I'm trying to find the minutes. Where are they?
I have
Well,
one
while you
item for
find
the,
minutes, I'll talk about vent. So we just met yesterday and we were trying to, our contract with ARPA was a little tricky. It's the way it's to reduce the liability of all parties. So we kind of figured out a faster track of reimbursing our awardees that were awarded in July. So we're really excited for that. There were 4 little ones and 2 big ones. So still waiting on, so when I say 4 little ones, those are between $2,000 and probably $1,000 awards. And then our bigger ones are up to 10,000. So that's good news. We just closed our second round, which I think we gave you an update on that. We had expanded, let me see if I can remember that off the top of my head. We included restaurants, bars and event venues, indoor event venues, but we added childcare, not studios, yoga studios, childcare, and places that served the underserved population. Is that correct? Did I catch all that, Joanne?
Yep.
Yep. And so we have about, it just closed yesterday, and we have about nine applications to review. Some are not complete, so that'll take a little bit, but kind of eyeballing them, it looks like we're kind of getting closer to our actual ARPA funding of 50,000. So that's pretty exciting.
That's great.
Great. And the deadline for that to spend?
Oh, June 2026. So, and that's really to wrap it all up. So we've got plenty of
Okay.
time. And if we need to, we'll do a third round, but I think we'll see.
Yeah, so a member of our committee who is not a public health person, but a very interested in this and very sort of tech savvy guy went to what meeting did he go to?
He went to the Downtown Northampton Association.
And to meeting of lots of businesses, and got a lot of interest in, got a lot of businesses expressed interest and submitted applications. So that was great.
Great.
All right, I am going to try to share my screen. Let's see. I sent the minutes out just a little while ago, so you may not have.
Ed, one comment, Joanne.
Yeah. Sure.
Sorry.
Oh. I got it. So can you see this?
Yep,
Okay. Did you have a chance, anyone have a chance to look at it?
I did.
Yeah,
Mm-hmm.
So down toward the end, we're referring to the hearing tonight as being on January 19th. So I think that should be down farther, January 16th. There it is, motion.
Okay, that's 16. Okay. And I was going to just correct this. Healthier Northampton campaign was launched in October 2024, right?
and
Anything?
the question mark needs to come out too.
Okay, I just put that in because I needed to look at that.
Thank you.
Anything else? Do you feel, Suzanne, have you not had a chance to look at it? Then we can maybe hold the vote till next time.
I looked at it.
Oh, you did? Okay.
I looked at it. I have a question about opening paragraph. This is just to refresh my memory, please. Counselor Maori, the second, she noted that state shield law protects healthcare data, but is primarily focused on police departments. Is that statement correct? I don't remember the link between healthcare data and a focus on the police.
I think that's what she said.
Okay.
Kelly, did you get this from the recording? And that's why they recommended that we do a local policy that would apply more to city employees.
Okay. I should have looked up the state shield law myself, but I didn't. I just hoped somebody would know.
Kelly said she'll check.
Thank you.
Anything else?
Those were my couple of ones.
I just want to make sure this acronym is correct. This has something to do with an alcohol licensing commission. Meredith, is that correct?
That's correct.
ABCC. All right, I'll take that. We'll take that yellow stuff out of there. And anything else?
Could I just throw it in AI? This is going to be so annoying over time. I know. It's annoying already. Massachusetts enacted a law often referred to as the Shield Law that protects people in Massachusetts from the consequences of civil and criminal actions in other states that restrict or criminalize reproductive or gender affirming care. So that language, that's an AI, just saying, qualifying that way, but
that doesn't tell us whether it's directed towards police or who in the state.
right.
All right, well, Kelly, we could tentatively approve it if you want, and then Kelly will get back to us if she refers back to the recording.
Yeah. This is legally protected healthcare activity, which includes accessing, helping others to access, or providing reproductive healthcare services and gender affirming care. It seems like it's more focused on the medical spectrum. And I'm looking at a mass.gov document, so this is not Dr. AI. I would just question that particular sentence.
All right, do you want to hold off on approving the minutes until we clarify that?
It would be a quick vote, then or now. I just think that's the shield law and our building around the shield law is central to this whole discussion. So I thought it was important that that statement be correct.
Okay, we can look into it and hold these minutes till next time. That's fine.
Thank you.
Okay. I see. Oh, Kelly's telling us what she found in the transcript. All right, we can even clarify with our research or with Rich Mayori. I see Attorney Porter is here. But I don't know.
Evening.
Good evening. Is your client here or is he going to be coming?
He may be coming, but I can certainly give a status if I think ultimately that's what was before the board tonight, unless I'm mistaken. Was basically just a status on the liquor licensing transfer for the buyer. So certainly happy to enlighten everybody on where that stands.
Joanne, I'm going to recommend that we just open up the hearing at 6:35 as on the agenda.
Oh, he's right here. Mr. Patel, he's the client, right?
Yes.
Still, in
Yep.
case in case there's any comment, I would still refrain from opening conversation.
We're going to wait till the assigned time.
Mhm.
Okay, so that hearing is slated to open at 6:35. Is there anything else you want to talk about until then, or do you want to take a little pause? Amy, you're muted.
I would love to talk about environmental health, probably take about 4 minutes, I hope, or quicker. So it's a good opportunity. I put it together some stats from the inspectors, the work that they did in Northampton for 2024. They have a huge umbrella, as I know you heard before, but for housing and nuisance complaints, those are complaint driven. They received 231 complaints, including this includes inspections, correction orders that they write when they find that there are things that are against the regulations, and follow-up inspections for compliance. They have 242 food service establishments. They do 2 routine inspections for each. That includes restaurants, but concert venues, bars, and all of our retail. So there's 2 routine inspections per year, but there are also lots of follow-ups for that. When there are violations that feel that they need to go back for, they'll provide education and get them into compliance. New food service operations in the city, there were 26. So that includes things like it's a pre-operational, pre-operational plan review. So that's pretty comprehensive that they do. And then usually a courtesy walkthrough to make sure that the things that are in place are there. So there's no surprises for the owners when they open, that they're all set to go and everything follows food code. Farmers markets. So the farmers markets are super popular in Northampton. There's 3 in the summer, and one is our winter market is open now, and that they actually have 79 vendors rolling through the year, but they all need their applications review, inspections for them, and then follow up as things sometimes change for them. Temporary events is also big, 58 events this year with 175 vendors. It's all again through application review. That's like application is like almost a pre-operational review, like what's on paper, what are they doing, what food are they going to have, how are they going to store, how are they going to do things like that, and then they actually go out and do the inspection at the time of the event. Mobile units this year there were 32. I don't have the data, like I feel like it's growing, but I don't have that exactly. Again, application review, and they work with the fire department at most times doing the inspection at the same time, because if it doesn't pass fire, then they're not gonna, we inspect, but they're not gonna be able to be permitted to operate until they do. Car seat inspections, 43 seats, inspections and education. That's through the car seat grant. Thank you, Donna. We do have a beach. It's kind of sounds a little funny in Western Mass, but we have Museany Beach, and that's something where they are also pre-operationally inspected, review of weekly bacteria counts. Sometimes that bacteria can go a little bit over, and there's a beach closing, and then further bacterial counts, what do I want to say, testing is done, and we make sure that it meets the correct levels to reopen. Something we do with Connecticut River Conservancy and the Western Mass Fish and Wildlife is some cyanobacteria surveillance. So we work with them, and we had 3 blooms last year. And that's just postings and then retesting through observations and working with both Connecticut River and wildlife. We actually had a fish consumption advisory this summer for the Connecticut River, and based on the PFAS levels in the fish. So, for different types of fish, how often you could eat it, based on what was being fished out of the Connecticut River. Recreational camps, those are big for us. It's the recreational camp season. It's starting in pretty much May through the summer, but the heavy months are May through June. There's 11 of those. Lots of documents. It's a lot of pre-operational review, making sure that they have what they need ahead of time, permits and inspections and policies. And then there's more of the on-site review where it's immunizations for staff and kiddos and things like that. And MRVPs are mass residential voucher inspections. We had 16 of those. That's where it's an inspection before someone moves in who holds a voucher from the state. So they want to make sure that it meets minimum housing standards. And demolitions, we also sign those off. We do the extermination witness to make sure that there's no pests there before they demo the building and the pests go moving on to the neighborhood. So we ensure that, which also comes into a little bit in place of Title V if Title V is on the property. And believe it or not, frozen desserts are not just the kind that we get in our little half gallons. They're actually the soft serves. So they are also tested monthly. So when we get reports back, and they are also outside of what's acceptable, they need to be retested, and we follow up. If it's still outside, we have to shut them down and follow up like that. So that's just some of our things we do throughout the year, amongst a lot of other things, but that's my update.
Thank you for letting us know, because I did not know all that. That you guys, your inspectors, do the bacterial counts at Musanti Beach?
Yes, we do. Well, they don't. They actually collect. They have I think he's the head of the lifeguards that he certifies that. He does that once a week. So they do that. Does it on Monday, sends it on Tuesday, it comes back real quick. Oh, I forgot about our semi-public pools. Silly me. We also do that too.
That's quite amazing.
Yeah.
We now have, we use, what is it called? WimWam, a database that it's easy to pull these types of numbers out. I could ask Amy anytime, how many inspections did we do in a month? We didn't have a software program that would do that for us before, so that's amazing. Thank you, Amy and the inspectors, for all of that good work. It's a lot
Thank you.
and a lot of training in addition to. Few other updates. We have our Hampshire Hope coordinator starting Tuesday, the 20th. So next week, her name is Lauren Kelly. That position's been open probably now for about 6 months since we promoted Taylor to prevention director, who she is doing an excellent job at that. That was a wonderful decision. So we're excited about that. The public health nurses came to me a few weeks ago about an idea that they had about some type of commemoration for COVID, like a plaque or a bench or something that we could have to honor the people who have lost their lives or were impacted by COVID in some way, shape, or form. Those who served and helped people during COVID, not just first responders or medical professionals, but they did a nice job providing me an outline, which I don't have right now, but they want to do something which I brought to the mayor's attention. And they're super supportive of that. So the nurses will be working on that little initiative. But we did find out while working, while we were looking into this, that years ago, and I thought that the city council did, they passed a resolution identifying COVID Awareness Day in the city. And Scott or Amy, do you remember what day that was? It's in March, I believe.
Yeah, definitely in March. I don't know the exact day.
Yeah, so we
March.
might, yeah, try to tie in whatever we're doing with that. But I thought that was a really nice way to honor and not forget about public health. What else?
How are we doing with the vacancies in the DCC?
So we just did a hiring of a new cohort about 8 weeks ago. We hired 6, only 3 have made it through. One just didn't show up, one lasted a half a day, and the other maybe 2, which is unfortunate. So 3 are just finishing their training right now. Unfortunately, 3 new community responders doesn't get us to a place where we can expand operations. We really needed a team of at least 5 where we could keep the doors open longer or on the weekend, at least one weekend day. So we're gonna have to rethink what that looks like. But what it does allow us to do, which is really fortunate timing, is like we've been able to operate as a warming center in the DCC community space, not just, you know, during our normal business hours. We stay open till 7:30 or 9 o'clock at night, you know, on the real cold, frigid days in hopes of getting people who don't have shelter a place. So we'll be doing that because we're expecting a cold snap again this week, Monday, Tuesday, and Wednesday. We're going to extend our hours at the DCC community space to be a warming shelter and hopefully make connections with CSO on Industrial Drive to get a bed or an emergency hotel stay. And the same with Manna. We work with Manna and Craig's Doors.
Great, thank you.
Yeah.
So we're getting to be about that time. Question, Meredith, that we had last time.
Sure.
When we open the hearing, do we close our meeting?
Yes.
Okay, would someone like to make a motion?
To close the meeting and open the public hearing.
Is there a second?
Second,
Any questions or comments? All in favor? Cynthia?
Yes.
Suzanne?
Yes,
Joanne? Yes. All right. So we have voted to open the continuation of a hearing for a tobacco violation permit for a violation of the City of Northampton Board of Health, a regulation restricting the sale of tobacco products and electronic nicotine delivery systems regulation. Does the city have anything that you would like to add to this discussion?
So this is a continuation for the hearing for the permit revocation.
Mhm.
And just to recap, the original hearing took place, I believe, in November?
September 19th.
September 19th. Thank you, Donna. And the business and their attorney at that point asked us not to make a decision in order for them to find a bona fide buyer of the establishment, because if you revoked the permit, it would be gone indefinitely. So the board said that they would continue the hearing. And you've done so every month since then. And I'm assuming I wasn't at the last meeting, so I'm just catching my brain up too. That the attorney and or business owner had come again to say that they're moving forward with the sale of the business. I think that's where it was kind of left.
Correct.
Correct. So,
But just to recap that the business owner admitted that the acts happened, right? And understood that there was a move to revoke that permit, but we decided to continue so that they could go ahead with the sale.
right, and and the board decided to continue with the what's the word I'm looking for?
Parameters, understanding.
The understanding, and which the attorney and the business owner agreed to, that there'll be no tobacco or nicotine products in the store, and they will not be selling any tobacco or nicotine products because their license is suspended, and you're only offering the grace of the continuation with that as a stipulation. So I'm here today to tell you that we had received multiple complaints that they were still selling tobacco products. So we asked someone to try to purchase a product, and on January 9th at 2:30 p.m., a sale was made of a nicotine product from this establishment. And not only was it a nicotine product, it was menthol in flavor. So it was a flavored product, and it was over the legal limit of nicotine of which you're allowed to sell without being an adult only store. So they had multiple violations of selling this product when they weren't even allowed to sell. So you need to have that information, and Donna can provide testimony about the whole sale, but you need to factor that in today when you make any type of decision.
That is in fact the second sale during the suspension.
could I get a clarification on what our options are, given this new information?
They have telling you they sold it today. I don't know. The option is you can continue, and they can continue to look for a buyer or to go through a sale, or revoke the permit. They have broken the law. I'm actually working with the attorney, our city solicitor, and may file a criminal offense as well.
Donna, do you want to?
Can we ask Matthew Porter and Rakesh Patel to be on screen as well?
I just wanted Donna to testify to her findings.
Yes, we received multiple in the last week or two complaints regarding the establishment selling tobacco again during their suspension. So we sent a person in to attempt to buy a tobacco product. And when they came out, they had the tobacco product in hand, which was the Juul menthol pods, 5%, which I do have here. And that was just this past week.
Thank you.
I'm sorry.
Mr.
interrupt you.
Patel, go ahead.
Yeah, I'm sorry. Can we see that in videos or something? Do you have any kind of proof? Because I mean, I understand you probably getting complaint or something. They would complain before that we were selling like underage, which is we never did underage, but there was prior complaint to that. I'm sure like for the beer and wine, you probably send a lot of people underage checking or something. We never ever got caught. So I just want to see something that you have approved there, because there is literally no tobacco products in the store since almost 2 months. My business went down to almost like $1,100 a day right now. So there is no product in in the stores. So I mean, I don't understand, like, where'd you get, like, how'd you get a Juul? Can I see something in like evidence?
Donna, can you show them the evidence, please?
No, something that you bought it from the store. Someone like, so I can match it, prove it. I mean, says like, okay, they did came to the stores and buy it. I mean, I want to see something.
Mr. Patel, it's the testimony of my inspector from the DHHS. We sent someone in, the purchase was made.
Ma'am, I checked the cameras. The time that I got a letter, I checked the cameras and I did not see any sales of tobacco. That's why I'm just saying, like, I mean, I want to know like how this happened. Either cameras lying or something happening,
Donna, can you describe the clerk that was there that day, please?
Yes, the clerk that was there was a younger gentleman, short, dark hair. There's usually two gentlemen that are working there, and one is a taller. This was the shorter of the two.
And what time was that exactly, at 2:30?
It was right around 3 o'clock on that day.
Because the time that you send the letter, I checked the review the cameras, because I mean, like, I personally went there and took all the stuff out and I put them into the storage. I've been paying the storage fee for it. So just to make sure there's no tobacco product in the stores. That's why I'm sure you're right. You did your, whatever you have to do it. That's why I just want to know, because the time said 2:30. I checked the cameras from 2:15 to 2:45 and I did not see any sales. Yes, I see like few beer and wine sales and regular candy sales, but nothing like a Juul. It was not at the counter. Unless they made a sale like in the back door or somewhere outside the store, that's different, you know what I mean? But not at the counter. I do have a video too. I can provide you video too if you like.
You have the video for the day?
Yeah, I do.
Mhm.
That's what I'm saying. I see at the counter like entire that transaction for half an hour, and I did not see at the counter. So I want to know where the sale made out to.
Can I just ask a question? If does every sale require the clerk to enter something into a computer that
Yes, if they
documents
use the
that
credit
sale?
card or something. Yes, they do.
And
When they ask
and
for ID too, even like if somebody, let's see, even you go in and trying to buy tobacco or something, the register will ask you like how old you are and stuff. So we have to put like, either take the ID, check the ID and put the date of DOB inside,
So,
That's-
oh, sorry, go ahead.
I guess what I'm saying is that there must be an inventory, or there must be some kind of documentation of what product was actually sold at
Yes,
around that time.
yes.
Unless it was a product that wasn't part of the usual inventory and was
Yeah.
kept elsewhere because it was already unlawful to have tobacco products in that store. So it wasn't done at the cash register. It's done on the side, and it was cash exchange.
It was cash because the person who purchased it went to the ATM machine and got cash to make the purchase.
So
Yeah,
the person went to the, go ahead, man.
I'm sorry, and I apologize for my camera. This is Attorney Porter. For whatever reason, I cannot get this to work. So obviously, Rakesh is adamant that there hasn't been any product for sale. I mean, if something did occur on that day, and we're certainly happy to review all the tapes and go through all the testimony, it would have been by a rogue employee, and certainly not a transaction that was done in the regular course of the business. From our perspective, these folks understood what was at stake. We've moved forward with, the new buyer. They're going before the town next month on their liquor license transfer application with Northampton. So we're at, nearing the finish line with the transaction. There would be absolutely nothing to gain by a small tobacco transaction at this point. Certainly understand this under the circumstances. It's jarring to me. Mr. Patel did pass along the cease and desist letter this morning, which I tried to read through and could not figure out in the wording whether this was discussing prior violations or new violations. Our intention, really to come before the board this evening was to just give a status update on where things stood as far as the transaction. And this has certainly sent us for a loop. So, I would ask, and I can certainly understand if the board did not want to continue it a whole month, based on the new circumstances here. But I would certainly ask this at least be continued for a couple weeks so that we can try to review what happened here to get a better understanding. Because this certainly was not, under the direction of something occurred of the business owners at all under any circumstances here. So.
Because just think, like, we already lost like 3 months worth of business, right? Now we already just have one more month to go. Why would I be doing this, stuff that are gonna make me lose like almost my whole business? It's
Mr.
just a
Patel, I
month.
don't mean to seem disrespectful, but it seems to be your business model. Like, you own the store in East Hampton. I was at that hearing as well. You blame your employees. Maybe it's your employee there. You actually gave us some mistruth at one of our meetings, and you said that after we had that meeting that I called you into with my staff, you said that you were getting rid of the employee that was doing that. And you said that to the Board of Health on a meeting. You did not fire that employee. That employee still works for you. So I'm sorry if I don't believe everything that's coming out of your mouth, but I do believe my inspectors when they're saying that they sent someone in to try to purchase a tobacco or nicotine product and the sale was made.
Ma'am, I don't know, like, if your inspector saw the sign at the window that I'm looking for the employee. It's been there for over a month and a half now. It's been there looking for the new employee, right? Even not only for me, even the new owner.
And it's your business. I don't know what to tell you.
No,
You're
but
selling illegal products out of your business. And whether you know it or not, someone is doing it. And I'm telling you, it's been more than this one time.
ma'am, but I'm just saying, like, just think, like, it's only 1 month left. Why would I
I don't
be
care.
doing this?
You don't deserve to. I'm gonna zip it because it's
Yeah,
the board's
please do.
decision. Did you have something to say, Mr. Porter?
I did not.
I thought I heard something.
That's what I'm saying. I did check the review of the cameras, and you can go ahead and do it too. If you want me to put them in the thumb drive, I can do that. I can give it to you. You can see the counter. There was no sale made at the counter.
Mr.
That's why I
Patel,
wanna know.
does your camera, do you have enough cameras to view the
Yes,
entire
it pretty much
premises?
covers the whole stores. Yes, ma'am. Outside, inside, yes. It pretty much covers the whole store. But my thinking was, like, if it's a mass, sales made on the counter, obviously they have to scan or credit card or something happen. It would happen at the counter, right? Because you cannot take credit card machine to any other corner of the store.
It was cash. It was
Yeah, so
stated
now,
that it was cash.
okay, so I mean, I checked it from the time being from 2:15 to 2:45. That's what I checked it, and I did not see it. But now the Donna says 3 o'clock. I'll go back and check at 3 o'clock.
And may I just add one more thing? We asked for the footage in the East Hampton Board of Health meeting as well, and they sent us edited footage.
Ma'am, there was the camera. This is the new camera. That camera, I just bought it like a year and a half ago.
Okay, gotcha.
That's what I'm saying. I can give you a thumb drive, or you can send somebody from yourself over there if you like.
Suzanne?
I think the board has bent over backwards over and over again to try to assure that the regulations were being followed and allowing Mr. Patel to not lose his business. But I also believe the inspector that method that is used for seeing if underage sales are occurring, or in this case, sales at all, has been tried and true and used in other settings as well. I've lost my patience.
Ma'am, it's already application is in there already for the new buyer. And it's a circumstances, with approval of all the license, ma'am. The application is already in. Beer and wine.
I'm aware of that, sir. I'm aware of it.
Oh, okay.
We've been the ones granting you the continuance. So yes, I'm aware of that. Frankly, I don't know what to do except to let you continue to do this, or at some point to say, I'm sorry, you have done this repeatedly, and we've been unable to convince you otherwise, or your employees otherwise, and there has to be something that occurs to make you know that we're serious about this.
Just quickly, would the board give us sufficient time to just review the tape and confirm that there was a sale by an employee? Certainly, if there was an unauthorized sale by an employee, we could assure the board that person would be terminated immediately. And if it means Mr. Patel, if it means,
Mr. Porter, we've heard this before. We've heard this before. This is a repeated story, and yet we seem to get the same result.
Yeah, I think the only difference here is that, while there is certainly an admission, to the prior violations, I do not believe that Mr. Patel or I could say with any bit of certainty, other than just the cease and desist letter, that another violation occurred here today. So I can understand the board's frustration. It's entirely understandable. I would not ask for another month-long continuance and understand this thing is no longer just sort of on a status update, basis. But if the board could allow us to try to determine, what occurred here and whether a violation did occur. I don't know how often the board meets. I don't know if it's on a weekly basis. I think at this point we would ask for just a 1 week extension, if that's possible, just to try to determine what happened here. I mean, there are no disputes about any of the prior violations, but I don't think that there's sufficient enough information right now for us to determine whether or not this occurred or didn't occur, or what occurred under these circumstances. So all of that being said, I do understand the board's frustration.
Mr. Porter, I'll give my personal opinion about this. If you have a video recording that does not show a sale at the counter with the cash register, that doesn't indicate to me at all whether a sale did or did not occur. It just did not occur in that specific location.
And I'll say that Donna Bowman is a professional and has been doing this work for many years. And I think we've come to trust her and take her word.
Right. But what I would say is, if the sale was made outside of the store, isn't that beyond the pale for what an inspector should be doing to try to elicit a sale? I mean, certainly from a liquor perspective, those sales need to occur. If it's an underage sting operation, those sales need to occur in the ordinary course of business. They need to go before the employee. That needs to be sold in the regular course of business. I mean, it would seem to me to go far beyond the pale if the inspector is going, to some undisclosed area within the store to try to elicit a sale from an employee here.
No
I
one
mean, we're
said
just
that.
trying to
No
understand
No
what
one
the
Yeah.
said that
circumstances are of
occurred.
this.
No one said that
Yeah.
occurred.
Donna testified that they went into the store and came out with a jewel. Donna, do you want to
Is that
comment?
individual here this evening so that we could discuss this?
No, we don't bring them to the hearings. We don't disclose their identification.
So Donna, one more
There's
question.
reasons it's part of the protocol.
No, that's fine. Understand. Donna, one more question. Did that person tell you the sale made like at the counter or somewhere around the corner or somewhere?
Yeah, the sale was made at the counter. He had to go to your ATM machine in the store to get the cash out for it, and then he went back to the counter to give the clerk the cash.
And you said that was 3 o'clock.
And Donna, you also said that we've been getting complaints.
Right. We received two more complaints last week regarding the store selling tobacco products.
In complaint, they can just use our store name, like just complain. I can just call up and just say like, okay, I did here. I mean, I don't know what to say on the complaint wise. There was says like, complain about the underage before too, which is we never did it.
Would anyone like to make a motion?
Our options are to just help me with this, to revoke the permit.
Mm-hmm. Or to
Um,
continue.
Or to continue for, a period of time to look at a video, or to not look at a video and take someone's word for what was not on the video. Is that what we're saying here?
I think the motions are either to continue the hearing for another month so they can try to sell the business, or to adhere to our regulation, and based off not even this last thing that occurred last week, but they had 4 egregious violations. So we're continuing the motion to suspend, or excuse me, revoke their permit indefinitely. So I think those are the 2 things that you're looking at. And I just want to add that this doesn't impact you continuing working with the ABCC and the local license commission to get your liquor license. You just won't be able to sell tobacco and nicotine anymore. So those are 2 separate things.
Right. But as a result of that, the new buyer, just for clarity's sake, that new buyer would be unable to apply in the future for a tobacco license.
Correct.
Unless one opened up, no, it would have to be in that location. Yeah. That's
Yeah.
right.
What if our client were to commit to closing the store until such time that the sale occurred entirely? So that there would be absolutely zero possibility of this occurring at any point. The doors close entirely, which may jeopardize their transaction, and I would have to speak with buyer's counsel on this. But if they were to agree to close entirely from now until such time as the transaction occurs, would the board consider allowing this transaction to move forward and allowing that buyer to reopen only at such time as the transaction closes?
And what's holding up the transaction now?
Right now, the application has been filed. The select board has confirmed with the buyer's attorney that they have the application in hand. The buyer has paid their application fee, and now it's just to the select board to set a hearing date, which should be a February hearing.
For the
And then
alcohol
from there,
sales?
Is it still the same
correct.
buyer
Yes.
from the original PNS?
Yes. Yep. Same buyer. Yep. And Tom actually provided. I'm sorry. I'm blanking on the gentleman's name from your office who we've been in touch with, just keeping the status updates. But Tom actually included him on an email this morning just to show that, the license, I believe it was Scott that was on that email, just showing that the application had been filed and that it was before the select board to set a hearing date. So, under these circumstances, the ABCC takes about, they're about 2 months from the moment of town approval. Obviously, if the board would allow us to do this, we would try to push that through in a quicker manner. But this obviously, this takes a huge chunk of their business away, and I'm not sure whether the transaction lasts throughout it. But I think it does give him some hope, because I know with utmost certainty that if this license is revoked today, then that's going to terminate the transaction, which is essentially going to drive our client out of business, and certainly they will not have any more prospective buyers on this. It's too difficult of an industry to run without all of the licenses and permits being in place. So if the board would consider that, I think that we would certainly be open to it.
And who would inspect it? That's actually happening.
Well, I think it would be pretty clear if a store was closed entirely. I mean, it would have a closed sign, and I think any individual could walk by that store and see. I mean, again, Rakesh, I mean, you can weigh in here certainly as well. I mean, if that is not something that you would like to do, and
I mean, I don't mind doing that, Matthew. I don't mind doing that. That's fine. I mean, I'm gonna be there for only like, the matter of the license get transferred. But what happened if if the new buyer come up and, after 2 or 3 months, whenever they open the door and there's no sales, like it's gonna take another 6 months to drive customers back or something. But obviously, I just have to reduce something, give them some reimbursement or something.
You also have a $20,000 fee that has to be paid.
Yeah, I saw that in a letter. Now, was there for the 4 violation?
That was for the sale of the flavored product, which is a violation, selling without a permit, over the legal limit, and what was the fourth one?
Flavor?
What was it?
Flavor?
No, there was no ID asked for the product. And it's Northampton
Okay, yeah.
is in We Card All city.
Yeah, I mean, there, if it's yeah, I mean, if it's did something wrong, then that's fine. I can pay, out of the money from that I'm receiving it.
Yeah, I think what he's trying to state that is, if the board, there's no dispute over the $20,000, we would just ask that the board allow that to be paid out of the sale proceeds when the business closes. I think the letter stated 21 days. I mean, we would just ask the board to try to make it, if we can make it so that it could come out of the sale proceeds.
Well, the regulation
be the
doesn't allow
request.
for that, I don't believe.
Okay. That's fine.
Would anyone like to make a motion?
Well, I'll put it out there for a vote. I move to revoke the license, the permit.
Is there a second?
I'll second.
Any further discussion by board members or staff?
So is the board no longer considering the option of closing the store?
We're in the middle of a vote.
Okay.
Any further questions or discussion?
It's unclear to me whether closing the store until the sale is within our purview, is an option for us within our regulations.
Well, we would be doing so voluntarily.
I understand that, but I'm talking about the options that we have as a board to vote on. I assume that that would fall under our option to suspend for yet another month.
To
And
continue,
that we,
yeah.
that we would then, you would say that the store is being closed, no sales, and it would be our responsibility to monitor that, to assure that that's being adhered to. And when we've been monitoring it for tobacco sales all along, there's been a violation every time there's been an inspection. So the track record of adhering to the regulations are not good, and that would be a real stretch to me to give the owner yet another favor.
Yeah, I understand that. I mean, I would say though that if the store is closed, I mean, there is zero possibility of anything occurring whatsoever because the store will be entirely shuttered. So, you know, while I understand the concern because of the history here, I do think that it, you know, alleviates any possibility of anything occurring because the store will simply not be functioning. It'll be
We
entirely
wouldn't know that
closed.
unless we were monitoring it, and that's not our job to monitor that. We can't do that.
Can I
you would
also
see,
add
like, you
something
know-
in the regulation? It says, any permit surrendered, revoked, or, because a retailer no longer sells tobacco product, or because a retailer closes the retail business, the permit shall be returned to the Board of Health and shall be permanently retired.
Yeah, I mean, we would be asking to close it on a temporary basis to allow the sale to occur.
I just think we've been asked to do so many different things. Like, I think this is the third time on, well, this isn't ready or temporary basis. And, you know, anything can happen, like the application gets held up. And so here we are back again in another month. It just seems like we keep going down this rabbit hole in this situation. So we keep making, you know, in good faith deals. But this is another deal that we would be making to close the store, and for what period of time, you know?
Well, there's a motion on the table to revoke the permit. Any further comments or questions from the Department of Health or the board members? All in favor? Suzanne?
Yes.
Cynthia?
Yes.
Joanne? Yes. So the decision's been made to revoke the permit, and it will be permanently retired.
So now just one question, like what happened if the buyers back out now? If the buyers finds this out and if she decide to like no longer buying a business, so I wouldn't have no any other chance to.
I would interpret it as meaning you would, let's see, the license is, well, help me out here, Meredith. The license is revoked. It's revoked to this particular owner. So even if you wanted to not sell and reopen the business, you could not sell tobacco.
Right,
Is that-
so the tobacco permit is now retired, and you could sell the business without tobacco sales permit.
Yeah, obviously she would not agree with it because it says in the P&S, you know, I mean, like if a business, you know, if it helps you guys, I mean, I can give you the, you know, I mean, you know, it will be like a big banners in there, like the whole, it's only me in that, you know, on that address. So it'll be the parking don't even need to be open or anything. I would put the like, you know, 2 blocking cars or so nobody can even
Yeah, the vote has been taken and the decision's been made. Would someone like to make a motion to close the hearing?
Move to close the hearing.
Second?
Any other questions or comments? All in favor? Suzanne?
Yes.
Cynthia?
Yes.
Joanne? Yes. Thank you. We appreciate your attendance and we wish you luck.
We'll follow up with a letter in writing with the outcome of tonight's vote. They're already gone. Okay.
Mm-hmm.
Yep.
I think we've covered our agenda. Thank you, Suzanne and Cynthia. That was not easy. Thank you, Meredith. And
Yeah,
Donna.
I think we have a lesson learned here that like we should have stuck with our regulation. It was very clear what we should have done in the beginning. Giving grace just got us into this situation.
Yep.
Mm-hmm.
Oh, we had good intentions.
Yeah.
Anything else before we close? I did send around our meeting schedule for the year. There's 2 dates on there that I put question marks, March and May, that I'm not sure I can make. And then Kelly also noted that the date in June is Juneteenth and there's a city holiday. So we'll have to redo those dates.
Joanne,
Yes.
the email that I had did not have an attachment. Or did
I
not...
know, I messed it up, but then I sent it later. I sent it right before the meeting. So sent it again.
I didn't check my mail right before the meeting.
So that's tentative. And then I didn't put a date in for July or August because we usually sort of do a little doodle poll and see when everyone has vacation and see if we can pick out one date over the summer. So we definitely have to change the June date and maybe discuss the March and May when I was not going to be here. So take a look at that and see if is there anything else that we need to review, but we can talk about it next time.
Yeah,
So our next,
thanks
Go
for
ahead.
doing that, Joanne. And also, this was a kind of a test of how, like, there's only 3 of us. We really need that other position filled. So,
oh yeah, Meredith, any update on that? Did you discuss
No,
that
I
with
met with the
the,
mayor on Friday, asked if there was any applicants, and she was gonna review to see if there was anyone.
okay. So our next date is Thursday, February 20th.
Yep.
All right, and we can go over the calendar next time. Any other questions, comments? Thank you all so much.
Donna, thank you so much. I know this is tough, but really appreciate the work you're doing out there.
Thank you.
No, it feels uneasy and unsettling, to tell you the truth.
It is. It is.
Mhm.
Yeah,
Okay.
yeah. We got you.
Yeah.
Okay, thank you.
All right,
Bye-bye.
bye.
Do we
Donna,
have
do you want me to come
did
meet
we
you
vote,
and walk you
did
to
we
your
vote to
car?
adjourn?
Oh, yeah. Wait, we have to open the meeting in order to adjourn? Is that what happens?
I think we're just out of sorts. That was just really rough.
Yeah, we did close the hearing though.
Mhm.
Yep,
Yes.
And reopen the meeting.
we didn't reopen the meeting.
Not sure about that.
Okay. Well, then let's reopen it to close it, just to make it official.
I move to
Second.
reopen the meeting and then closing it in one motion.
Second.
Any discussion? All in favor? Cynthia?
Yes.
Suzanne?
Yes.
Joanne? Yes, it's closed at 7:13 p.m. Thank you all.
Thank you, everyone.
All right,
Bye.
bye-bye.
Bye.
Bye.